Hey guys, welcome back to F1 Survival Guide. For those who don't know me, my name is Sam Kwan. I'm one of the F1 from West Midlands Central Deanery, working at Birmingham Parents Hospital. Today again, we have got Shah. Shah is going to be F1 in August. She's also the web moderator for this teaching program. So Shah, I want to say hi to everyone.
Hi guys, my name is Shah. I'm, like Sam said, I'm going to be working as a junior doctor in Birmingham from August. So I'll be sort of asking the questions and stuff when we do our panel discussion later, so I'll be around.
So, today we have got a lot of people joining us. So, the last time, I'm sure that you know Liang from BMA. So Liang is here again just to answer some more questions about contract. So Liang, you want to say hi to everyone?
I will, yes. Hello, everybody. I'm here from the BMA, so of course your trade union and professional association. If you have any questions over the course of the next hour or so, please just pop them in the chat window and I'll do my best to answer them.
Cool, perfect. Thank you, Liang. And then finally, today we are very delighted to have a representative from MDU joining us, because last time I received quite a few questions about medical indemnity. So we have got Rebecca from MDU. So she's going to spend the next 10 minutes just to talk about what medical indemnity is and how, and basically how does MDU can help us as a junior doctor when there's some issue of medical indemnity. So please welcome Rebecca. I'm going to pass it on to you.
Thanks for that, Sam. Thanks for the invitation today. I'm really looking forward to sort of speaking to everybody and hearing what sort of questions you have about indemnity to help you with those. I know that there was a few questions last week, so I did watch last week's talk, which was really interesting to watch. And what I'm going to focus my presentation on is one of the questions that was actually asked last week about the difference between NHS indemnity and indemnity you get with a defence organisation. So I'm not sure if we can bring up the presentation slides at all and do a shared screen.
Yep.
Fantastic. So we'll start with a more generic introduction for those of you that haven't come across the MDU before. The MDU stands for the Medical Defence Union, and we are an entirely non-profit organisation. So what that means is that any money that we would ever take from our members gets put into a pool, and that pool of money is used to pay out the legal defence of doctors across the UK. So we don't have any shareholders, we don't have anyone trying to make profit from the money, it's purely to use for legal defence. Now we're the market leader in medical defence in the UK, so you have a couple of options when you're looking at organising indemnity. One is a defence organisation and one is an insurance company. So when we're thinking of the defence organisations, there are three main defence organisations here in the UK. So the first one is ourselves, the MDU, and we cover all jurisdictions of the UK. You also have the MDDUS, the Medical Defence Scotland, which covers the Scottish jurisdiction. And then you have MPS, which is Medical Protection Society, and they're an international company, so they cover a number of different countries. So when I say we're the market leader, we have more doctors with us at the MDU than the other two defence organisations and other insurance companies together. But with that said, the type of support that you get at a defence organisation is very similar between the defence organisations. There is a lot of differences between what you get at an insurance company and a defence organisation, but I'm not going to go into that too much today unless anybody asks any questions about that, and I can explain that further. Just for those of you who are new to the term indemnity, if you quite literally look it up in the dictionary, it states that it is protecting somebody from their own actions. So when we're thinking about you working as a doctor, we're talking about indemnifying your work from things like claims, compensation, complaints. Anytime anyone might question a decision you've made, it's about looking at supporting you through that. And that's done through guidance, support and defence, both with our medical legal advisors who are trained doctors. Perfect. So hopefully I have explained the answer to the first question here, which is what is the purpose of a defence organisation, and it is to support doctors on the front line with anything that is medico-legal. Why do you need indemnity, and do you need it if you work in the NHS here in the UK? And the way that I'm going to answer this is by explaining the next question. Just bear with me. There we go. So in order to explain that, I really need to explain the term multiple jeopardy to you. So this is a legal term that's used to describe how a single clinical contact, such as writing a discharge letter or making a decision about a treatment pathway, can lead to a number of different investigations. So it's unlikely for this to happen to an FY1, but it is something you need to be aware of going forward in your career. So that single clinical incident, as you see on the slide, can lead to a number of different things. The top one in dark red, so civil claims for compensation, effectively when a patient comes forward and says they would like to be compensated with money because of something that has happened, that is picked up by the NHS. So if you're doing purely NHS work and you are starting in an FY1 programme, your claims for compensation are picked up by the NHS. The ones underneath that are not supported by the NHS. And I often describe it to people as it's like the NHS offering you third-party fire and theft on a car. They're going to protect your patients and the other cars on the road effectively, but they're not there to offer you that support for you and your reputation. And that is what your defence organisation is for. It's to help you with things like the disciplinary investigations, complaints or GMC investigations. So where do you stand legally? Legally, you have to have somebody paying out your claims for compensation. So that's what the NHS do, and that's the tick on that you can work with what the NHS offer. So if somebody says to you they are NHS indemnified or state indemnified, what they're referring to is the fact that their claims for compensation are being picked up by the NHS. However, the GMC do actually put an ethical requirement on you. So this isn't a legal one, but more of an ethical requirement, asking you to have adequate insurance or indemnity cover. So the GMC do expect you to have considered this and look at putting something in place for yourself as well. These are the common areas that we see FY1s maybe contacting us for. With that said, if you want to see the sort of cases that we deal with, I would really encourage you to have a look at themdu.com and then type in cautionary tales, and it will bring up a whole group of case studies that we have worked with where doctors have given us permission to share their story and explain kind of what the situation was and then what support they got either with that investigation or that claim for compensation. It's a quick one to mention. I know a lot of you have already organised your indemnity for your foundation programme, which is great. But if you are one of those people that have, you still need to organise this and put it in place, you can do it by visiting themdu.com/Rebecca, which is myself. For somebody who is a foundation year 1 on a deanery approved programme, there is a cost of £10 for the whole year. So that starts from the 1st of August running through to the 31st of July next year. It's an entire year's indemnity. You can contact us as much as you like, use the advice line, make use of the e-learning modules we have, and there is one cost of £10 for that whole year. And then we also post you out one of the books that you can see on the slide as well. And I think that's all I wanted to mention today. These are my contact details. Feel free to make a note of my email address, rebecca.gould@themdu.com. So if you do have any individual questions, such as things about your membership, then you might want to save that rather than putting it into a group chat. And you can always email me and I will look to sort those through in the next few days. Hopefully that's answered the differences between NHS indemnity and a medical defence organisation. Hopefully, Sam, I don't know whether you have any other questions on that or whether that covers everything we talked about today.
Yes, thank you. Thank you very much, Rebecca. That's a very wonderful talk. I'm sure now people know a bit more about MDU and also what's the difference between NHS indemnity and also what MDU can provide in extra. So to be frank with you, I've recently renewed my MDU membership. So for those of you who haven't joined MDU, please join as quickly as possible. Just get it done before August, before you start your job. Okay, so let's begin our talk right now. So I hope you guys enjoyed the last 2 sessions and is getting yourself ready to start in August. So this session, I'm just going to quickly cover how to manage your eportfolio. Eportfolio is something very important for you, not only as a transition trainee, as well as when you're doing specialty training in the future. So you need to do well in your eportfolio so that you can progress to F2, as well as getting your certificate of completion of foundation training after your F2. So therefore, I want you guys to pay attention to this talk, and then I will try to go through everything as detailed as possible. So this is the rundown for today. It looks like a long list, but I'll try to make everything as short as possible. And then later on, we'll have a quick break for 5 minutes just to do a poll. And then at the end, I'm going to show you about my portfolio. And then we'll have a Q&A session for 30 minutes as usual afterwards. So just for your information, there are two types of ePortfolio. For those of you who will be working in English dictionaries, you'll be using Horace ePortfolio, which is the one on the left. Which is the one that I'm using at the moment. And for those of you who will be working in Scotland, Wales, and Northern Ireland, you'll be using another different type of ePortfolio. It's called Tourist ePortfolio. Their content is basically quite similar. It's just a different interface. And for this talk, I might focus a bit more on Horace ePortfolio, but don't worry about the Tourist portfolio bit. I've invited someone to come and talk to you guys about ePortfolio, Tourist ePortfolio afterwards. So let's just start our talk. So before your rotation, you should know who your supervisors are. So you have received an email basically from your postgraduate office saying that who your supervisors are. If not, then you can check it from your ePortfolio, or you basically have this email again to the postgraduate office to ask who your supervisors are. There are two types of clinical supervisors. The first one is clinical supervisors. So clinical supervisor, you have one supervisor for each rotation. So in total, you have like 3 to 4 clinical supervisors, depending on how many rotations you have for that year. Clinical supervisor basically is the person who will take care of everything related to that particular rotation, including your annual leave. And the other one is education supervisor, basically, which is a person who is taking care of your learning, your portfolio, your career management, and also about study leave and also the courses that you want to do. So one of your education supervisor usually is also your clinical supervisor of one of your rotation. And you have one, just want to clarify that you have only one education supervisor for the whole year. And you have to meet these supervisors at the beginning and at the end of the rotation. And also before the end of the year, you have to meet your education supervisor again, just to summarize everything. So make sure you book your meeting early, because these consultants usually they are very busy, and you need to, you want to get it right off the way. You have to book an appointment with them early, and then to have a meeting with them early. And it is also very important to know your supervisor expectation early, so that you can fulfill their requirement during their rotation. So before your meeting, you should think of something called PDPs, which stand for Personal Development Plan. So PDP is about what you want to learn, as well as how you're going to achieve it. You should get these prepared before the first meeting, and ideally you should have at least 5 for each rotation. And for PDP, you have to be smart. What does smart mean? So smart is actually a mnemonic of how you can develop a PDP. When you think of a PDP, you need to be very specific about what you want to learn. The outcome needs to be measurable, and that it needs to be something that is achievable for you. It needs to be relevant to your curriculum as a foundation trainee, and at the end, it needs to be something that it can be done within your time limit of that rotation. And during the rotation, you have to do something called SLE, which stands for Supervising Learning Events. There are 4 types of SLEs. So the first, which are including mini-CACs, CBD, DOPS, and DCDs. I'm going to go through each of it right now. So the first one, mini-CACs, basically is a working appraisal for that rotation. So you have to ask a senior, which ideally speaking should be F2 or above, to come with you and assess your clinical assessment when you're doing clinical assessment with the patient. And you need 3 of these for each rotation. And the second one is CBDs, which stand for case-based discussion. So you should pick a case either during your ward round or during your on-call, and then you have to discuss that with your seniors. And that seniors, this case, has to be a registrar level or consultant level. And you need 2 of these for each rotation. DOPS, which stand for direct observation of procedure skills, basically when you're doing some procedure which is outside from the core procedure list, then you can sign off as a DOPS. And then because DOPS and minicast, the nature, they are pretty much the same. So actually, one of the DOPS, you can count it as minicast. So in that case, if you have a DOPS, you just need 2 minicast and 2 minicast for that rotation. And at the end, for each year, you have to do something called DCT, which is developing clinical teaching. So how to do that? So in order to do that, you can find some opportunity to do some presentation for your departmental meeting as a teaching, or you can basically, you find a medical student on the ward and you can volunteer to teach them and ask one of the seniors to give you some feedback on that. So you can get it signed off, and you just need 1 for each year, as I said earlier. As all of you are now all grown adults and going to be a doctor right now, so it is very important, and also it's a responsibility of you to find your own opportunities to get it all done. No one is going to tell you, and also is going to it's going to tell you this is going to be a CBD minicast. You need to find your own chance, and you should volunteer to ask a senior whether you can get that assessment to sign off. So the good time for doing that will be during your on-call shift, when you're doing admission, and also when you are during your ward route, where you find a complex case and you want to discuss with your seniors, and then you get a CBD sign off. Remember that, bear that in mind. Not only doctors, but also allied health professionals can sign off your SLEs, including pharmacists. So talking about core procedures. So core procedure is basically a list of procedures that you have to do and get signed off before the end of your F1. So I basically have classified it into procedure that are usually being done as a doctor, which is on the left, and procedure that are usually being done by the nurses, which is on the right. So the one on the left, I'm sure that you guys must have a lot of opportunities to do it. So don't worry about that. Just find your own. Just find a good time, find your own opportunities, and get your senior to sign off. And for those on the right-hand side, might be a bit tricky because they are the ones that are not usually done by doctors. So in this case, I would suggest you to find a nurse just to follow them, and then volunteer to help them with this job, and then just to get everything signed off. So during your rotation, you have to also do something called reflections. Reflection is something that is hated by most of the trainees, I would say, and I admit that I don't like it as well. But it is required by GMC and also your trust to do it. So unfortunately, it's something that we have to do. And there's a minimum number for you to do but at the end of the year to achieve. So so I would say just spread out to each rotation and do some bits by bits. You should write some reflection based on your clinical experience. So what the structure I usually use is starting out with a brief description of what happened, and then I will talk about how I feel, and then I will talk about what went well for that event and what could have done better, and then I will talk about my learning. When you get stuck, there's actually something that's very useful for you to remember in mind that so that it can help you to think of what you want to write for reflections. It's called what, so what, and now what. So you need to know what happened, why do you want to write that reflection in particular, and now what, and what do you learn. Having said that, although a lot of people don't like reflections, it is something very good for mapping to curriculum. So what do I mean by that? So basically later on, I'm going to show you a list of the curriculum, which is basically a list of requirements that a junior doctor has to achieve by the end of their foundation year. So you have to provide evidence for each requirement, proving that you have achieved that, and then your education supervisor will have to review that and sign you off for this. So reflection is a very good tool to get these signed off. And then before the end of your rotation, you have to do something called feedback forms. So there are two types of feedback form. One is called PSG, Placement Supervising Group, and one is called TAE, Team Assessment Behavior. So let's just start with PSG. So for each rotation, you're required to nominate 3 people to your clinical supervisors. One must be consultant, one must be a senior doctor, senior than F2, and one should be allied health professional, including nurses, pharmacists, physiotherapists, occupational therapists, ward clerk, HCA, etc., etc., etc. And your CS will send out the ticket for you, and you need to remind your nominees to finish your feedback form before the end of the rotation. And the other one is called team assessment behavior, which is more self-oriented. So you have to do basically do a self-assessment, and then you need to send out some and then you need to basically find 10 people to help you to complete the feedback form. So 2 must be a consultant, and 2 must be senior nurse. Ideally, should be band 5 or above. So band 5 is equivalent to staff nurse level, and 2 need to be allied health professional. And these tickets are sent out by yourself. It's not sent out by your clinical supervisor. So bear that in mind. And you have to do it once per year. Usually, it's the first rotation of that year. And these feedback forms will assess you in 4 domains, including professionalism, communication skills, team working skills, and accessibility. And also, before the end of the year, you're required to upload some forms or certificates for your annual assessment. So the first one is PSA, which is basically the prescription safety assessment. I'm sure that most of you have done that before before you start your F1. You haven't done that, just book it and get it done straight out of the way. And the second one is some resuscitation course certificate, including your ILS, ALS, depending on your trust. I mentioned that in my first talk. Just get it booked early and just get it done over the way. The third one is about some evidence of quality improvement project. So basically, you have to get involved in some audit or quality improvement project for each year. So this one will be a separate talk for the next one. I'm going to go into more in detail. And then we have got career management. So basically, you have to write some reflections on of your experience of visiting some career websites, going to some career fair, career talk, etc. And basically, it's about your career plan on what you want to achieve in your future. And then we have got a Form R. So Form R is a very simple form. It's just basically talk about how many days you take leave or whether you're healthy or not. And then we have got a script modules, which is basically similar to PSA. They are both related to pharmacology. So you have to do, it's an e-learning thing. You have to do 60 modules for F1 and 50 modules for F2. So it's something that I would say, when you have a weekend, when you're free, just get it done out of the way. And then the last but not least, we have got something called NET survey, which is basically an evaluation of your training. Although it sounds very simple, but it's basically a lot of people, they forgot to do, and then they find out after the deadline and they failed their annual assessment. So I would say just look out for email when to do your NET survey, and then just get it done straight out of the way. And now, of course, depending on your trust, you have your mandatory training and you have to get it done. So last time I briefly mentioned about teachings. So I asked you guys not to miss any teaching and go to teaching as many as possible. So the reason why is that because you're required to attend 60 hours of teaching in total, and 30 of them are core teaching. And then, so what I mean by core teaching, so core teaching basically mean teaching that are organized by your local postgraduate office. And then you have got the other 30 hours for non-core teaching, which including environmental teaching, grant round, simulation, workshop, and then eportfolio, and then e-learning. So for e-learning, unfortunately, only maximum 6 hours will be counted to your total teaching hours. So it is very easy to be teaching because of on-call and stuff. So that's why I would say when there's a chance, just go to teaching. because it's very difficult to catch up if you have missed a lot of teaching at the end. So this is just to summarize what are the requirements for your ARCP. So ARCP stands for Annual Review of Your Clinical Progression. So it's a very important meeting between the your foundation director and you have got a panel of people and just to basically assess the e-portfolio. And it's a tick box exercise. This is a requirement on my trust and also different for different trusts. Your trust should send you basically what the requirements are for your ARCP. So basically just look at them, make sure you have covered everything and go for it before you submit it for your ARCP. So thank you very much for listening. So this is the end of a quick talk. So for any questions, you can send me an email. So my email is sam.kwan@doctors.org.uk. And remember to follow us on fy.medcast.com.uk just for the latest update for the further events. And yes, so I'm now going to show you about my portfolio. So as I mentioned, there are two types of portfolio. One is Horus and one is Tourist, right? So I'm using Horus portfolio, and people working in Wales, Scotland, and Northern Ireland, they're using Tourist. So today, so actually we have got special guests here just to help me to talk about Tourist portfolio. He was stuck in theater, so that's why he was a bit late. But don't worry. So let's welcome June. June is basically an F1 working in Wales. So for those of you who will be starting working in Wales in August, so you can ask him all the questions you want about the working environment in Wales. So June, you want to say something to introduce yourself?
Hello everyone, my name is June. I'm an F1 working in Wrexham Milo Hospital in Wales. And as Dan said, I'm going to show you how Tourist works.
Okay, thank you very much, June. So I'm going to start with Horus ePortfolio, and then we will go through Tourist ePortfolio. Okay, so this is my Horus ePortfolio. So when you log in, so this is basically is the front page that you will get. And then so when you want to do things, so you go to portfolio and then you click overview. So basically that's me. So now you all know my GMC number and which med school I'm graduated from. So this is basically my placement. So if you don't know who your education supervisor or clinical supervisors are, so you can find it here. So this is my education supervisor and this is my clinical supervisor for general surgery. And then now I'm doing pediatrics. And then, as I said, one of your clinical supervisor is also your education supervisor. So I'm now having the same supervisor. And then this is basically a good summary of your e-portfolio. So this is basically showing you how many SLE you have done, how many core procedures you have done, your report, your reflections, your certificates, your PDPs, your teaching log. And then so just want to tell you before you log in to the front page, when your first time log in, they might have to ask you to sign some declarations. So it's just a quick one. So just get signed off, and then we'll move on to content. So basically, this is just a summary of what I've uploaded. So as you can see, quite extensive thing. You have to upload. Just to give you a brief look. And then we talk about curriculum. So basically, this is a long list of curriculum that you have to achieve at the end of your F1 year. So you'll be assessed in terms of professionalism, communications, clinical care, and safety. So you have to upload some evidence on that. Another evidence, so you can upload as a reflections, as we have discussed, or any report that your supervisor did, or any course that you attend. Sometimes even e-learning can be used as evidence. So if you click on here, descriptor, so basically it will tell you what does it cover for basically each requirement. And then there's also an e-learning course for each requirement. So so if you haven't got enough evidence for that particular requirement, then you can do e-learning module just to make it up. And then this is for my PDP. So you need 5 for each rotation. And then you got your reflections. And then you got your tape here. You do 1 per year. Your career planning. And then this is your teaching law. So, and then if you want to send a takers like SLEs wise, so just go into forms, and then you got your mini CAG, stop, CVD, and then DCT is here. So let's just have a look at one. So for example, mini CAGs. So you basically just click the date, title, what happened. Remember, don't put any patient details on there. And then what setting is it? And then what is the focus of that particular SLEs? And then you can type your trainer in there. So if you type someone, it will just come up.
Right, so can everyone see my screen at the moment? So the content of the TRS portfolio is similar to the Horus portfolio. The only thing different is the layout. As you can see, we don't have a overview page, but here we can see the progress summary, which shows the curriculum coverage, SLEs that you've done, tabs that you have done, and core procedures you have done, etc. At the bottom here, it'll show you where you're working and your supervisor's details at the bottom here. If you scroll down a bit lower, you can see a quick reflection starter where you can quickly put in a reflection and submit it. And I'll show you how to link it to the curriculums later. Up here, you have the tab which shows you all different forms that you can fill in here, the curriculums, the tickets that you have sent, reflections you have done, and teachings that you have been to. So something important to mention before you start filling in the forms is the declaration. If you do not fill in any of these declarations and submit it, you won't be able to submit any forms in the future. So core procedures, they're all quite straightforward to fill in. So I won't go through all of them one by one. Excuse my slow Wi-Fi. There you go. So here we go. You can send in any procedures you've done, and it will show you if who the submitter is and the date submitted and whether it is done. So SLEs, I won't go through that either, and tabs as well. So supervisor forms will be here. Just to let you know, there's a few different forms available. There is the educational supervisor form, and there is the combined form, both the educational supervisor form and the clinical supervisor form to fill in. It is important that you do not get them mixed up, as that will create lots of problems for both you and your supervisor. So here we go. Mandatory certificates will be certificates you have to upload, such as the ALS certificate and the PSA certificate, which is the requirement to pass your ARCP. Quality improvement will be a form you fill in for any quality improvement project you have done. All these have been mentioned by Sam, so I won't go through them. So the PDPs, as Sam mentioned, you have to do 5 of them. Discuss with your supervisor and you submit it through this portal here. So record a new PDP and all done. F1 curriculum would be the curriculum that Sam mentioned before, which you will have to link with all your submission of forms you have done. As you can see there, you have to link each one of them. You do not have to link every one of them, but you have to link the minimum number for each section right here. Okay. So right here, you can see the tickets that you have created and whether the person you sent to has already filled it in or not. So it's a good overview to make sure that the person you submit to has filled it in and submitted after you send it to them. There we go. There's a good overview. And here is the complete and incomplete section to show you that. Reflections would be the reflections you have done. All right, so here I'll give you an example of how to link your reflections or any form to your professional curriculum. So let's say here I did one which is working overtime, which is something we all do. Click at the side here on the actions button, click link. Once you click that, it will show you an overview of your reflection and click link to curriculum. By doing that, you can select the curriculum that you have, you would like to link it to. As you can see, you can only link a maximum number to each curriculum for each form. So it's important that you choose which curriculum to link to that is most important. Such as for this, it would be continuity of care, personal competence, etc. All right. And right here is the training section where you can do e-learning to a maximum of 6 hours, as Sam mentioned. And also you can add in the teaching sessions you have done throughout the year so that you can fill in the 30 hours requirement. There you go. And here would be where to add on the additional learning, such as the ones that you have done. Okay. And after you have done everything, if you want to download any of the forms, you can click download here and click select forms for this grade. Okay. I think that would be it for the tutor.
So yeah, so let's head into our Q&A really quickly. So we'll try and wind it up by 7:15. Thank you guys for sticking with us. Could we, we've got quite a lot of questions about teaching, Sam and June, if I could direct it to you guys. So a lot of people have been asking how we log our teaching hours. Do we need our supervisor to sign that off, or do we enter it somewhere? How do we do that?
So I will start off from Horace's point of view first. So for Horace, you basically just go to the teaching log and then just go to create forms. And then basically just type the title of the teaching and type whether core is non-core. And then you type in, is it a seminar, grand round, workshop, or e-learning? And ideally, you should also type in a little bit detail about what do you learn on there, just to show the supervisor that you learned something. And for each teaching session, you should have a teaching log on there, and that teaching log, I mean, for core teaching, they your postgraduate office should keep a log. So don't worry about core teaching. So there's that. So you've got the evidence. But for non-core teaching, your trust might send you basically a form just to log in or teaching, and then you can ask your supervisor to sign it. Or the other way around, they some department like pediatric department, for example. In my department, we keep teaching both. So we just basically write down the name of who basically attended the teaching, and then that will be provided as evidence of your teaching. June, do you have anything to add?
In terms of QRAS, how they check how much you have logged, for my department, the postgraduate department, they gave us a keychain here, which has a bar. So every time you go to a teaching, you have to scan it so that they confirm whether you have actually attended the teaching. So at the end, when you submit a form online, there is no need for your supervisor to sign you off or for anyone else to sign you off. So it's basically just matching your teaching hours with what you have submitted.
Awesome, thank you guys. So another question is to do with ILS or ALS. So some people were asking, how long does it last once you've got it? How long is it valid for? And also, if you haven't done it in medical school, then how do you get it?
So thank you very much for the question. So ALS usually lasts for 4 years, and ILS usually lasts for a year. So depending on your trust, depending on your deanery. So your trust. So for my deanery in West Midlands, so our deanery asks us to do ALS straight away. So I did my ALS in F1, and then that's basically that can last for my whole foundation training. But I've heard also some other trusts in Oxford Deanery, for example, they ask the F1 to do the IOS and then do an ALS. But don't worry, your trust should give you instruction on how to register. Basically, your research office should give you instruction on how to register, and that should be, and the cost should be covered by the trust. So for those of you who haven't heard about anything, don't worry. Things will come through bit by bit. You know, it's COVID time, so they are a bit slow. So June, so what happened in Wales? Is this something similar?
Yeah, it's quite similar. What we've done is we've done our ILS before we started F1. So we can submit that when we start our F1 job. And we do our ALS over the course of our F1 year, which would be arranged by our postgraduate department. And another tip is that we get 30 days off for ALS, so do not take annual leave for ALS courses.
Thank you guys, that's great. There was a question to do with indemnity, which I just wanted to highlight. So someone was asking, do we need to sign up to only one defence union? So June has replied saying yes, at least one. Just wanted to pass it on to you, Rebecca, to say, do you agree with that? And is there anything you wanted to add?
No, that's absolutely right. As long as you have one, that's absolutely fine. There's no requirement for you to have more than that. We do know a lot of FY1s join more than one, just because they're still getting to know their defence organisations, but there's no requirement for you to have more than one. As long as you have one, that will cover everything that you need.
Thank you so much. And just another quick question while we've got you. So someone was asking, do we need to inform the MDU of rotations that we're working in during F1?
Well, that's a really good question. We will encompass anything that you have on your deanery approved programme. So that includes your rotations. So you don't need to tell us of any work that you're partaking in terms of your rotations and what you're doing as an FY1. The only time you would need to contact us is if you're doing work outside of your FY1 programme. So for example, if you take on a volunteering post, but actually the rotations themselves are all classed as part of your FY1 membership.
Okay, thank you so much. Leanne, if I could ask you a quick question as well while we've got you. So Leanne's from the BMA, just in case we haven't done the introduction properly before. There was a quick question here, which I've seen you've answered, but just if there's anything to add. So people are sort of worried that we're not getting our contracts early enough and we've not had any information in terms of that. What's your sort of take on that?
Yeah, it's not uncommon, unfortunately. You should have by now, if you're starting in August, received your contract. So you should get your contract 6 to 8 weeks beforehand, and the same with your rota as well. And your rota should include any kind of leave requests that you might have already put in. It doesn't stop you starting your role. That's important to note. You can start your job without your contract, but I can understand completely that you might not feel comfortable doing that, and I would feel the same in your position. If you're a BMA member and you want some reassurance about that, give us a call. You'll speak to an employment advisor. I did put the number in the chat window, but it's 0300 123 1233, or drop us an email, support@bma.org.uk. We can often intervene on your behalf. So if you haven't had your contract and you're feeling uncomfortable about it, let us know, and we'll see what we can do on your behalf.
Thank you so much. That's great. Could I ask June the next question? So we had a couple questions about sort of making time for your core procedures, and are there any particular examples of times which we can sort of get in quick sign-offs?
course procedures, like Sam mentioned, there's two different parts. It's the one that you do quite often, and the other one, which is the one you do not as often, such as film categorization. For the easy ones, you can do them in a daily basis. You basically do them all the time, especially when you're on call. That's when you get most of your procedures done. And for the one that are uncommon, it would be great if you can kind of take the initiative to look for it. So let's say you want to look for a female categorization, you can think of going to the gynae department and see if they need any help there. And maybe you can ask someone to supervise you while you do it. So it's mostly taking the initiative to look for it rather than sitting back and waiting for the procedure to come to you.
Okay, thank you so much. Sam, could I just direct the next question to you? So again, back onto the topic of teaching. So people are asking quite a lot about, does someone need to be there watching you while you're teaching? Do you need to have sort of a supervisor or a senior watching you?
Ideally, yes, because there is a form that they need to fill it in about what do you cover for the teaching, and what do you do well and what you could have done differently. So ideally, yes. So for example, like if you're doing big presentation, and then you can basically ask one of the consultant who is an audience about your performance of that teaching. But I do understand that maybe teaching bedside teaching might be a bit difficult. But just try to see if there's any core trainee or any other registrar available. And then or you guys can do a joint teaching together, and then you can help with some of the teaching, and then he can give you some feedback. That could be an option to do that.
Thank you. And while I've got you here, Sam, so people are asking, you know, all the information that you put into your slides about the requirements for F1 and things like that, and the list of all the core procedures. Is there anywhere where we can find this information online to come back to later?
Yes, sure. So basically, all the informations online are on the eportfolio. So once you get your eportfolio, things will be very, very clear for you. But if you are interested in terms of looking things right now, you can basically you can go to the website of the eportfolio on the TOURS website or the HORUS website, and they basically have a on the help page. They basically explain everything in detail.
Thank you. That's great. I'll pass the next question on to you, June. So someone was asking the ePortfolio, you know, once you've finished it and once you've put in everything, does anyone see this ever again? Is it important for specialty training? Is it good to sort of go above and beyond and do more sign-offs than necessary?
Yes, definitely. It definitely shows how keen you are in terms of completing the portfolio. The more you do, the more you show, the more it is related to what you want to do in the future, the better, obviously. And of course, after you finish the e-portfolio, it would be great if you can download it in case in the future, if anyone wants to ask you for a portfolio, you can show it to them what you've done over the year.
Thank you so much. And another question about core procedures, someone was asking, are they per rotation or are they for the entire year?
It's for the entire year. There's no maximum number or minimum number you have to do. You have to do at least one, of course, for each core procedure. And that would be for both FY1 and FY2. But of course, the more you do it, the more regularly you do it, you'll show your supervisor that you're constantly practicing and improving doing the procedures, and that would definitely show a good sign to them, of course. Yeah.
Great, thank you so much. So Sam, a question for both of you guys actually. The slides that you guys so very kindly showed us and made, would the people who are watching have access to them later or anything like that?
Yeah, sure. So thank you very much for the question. So basically all this teaching is recorded. So I'm going to post it online onto our Facebook page. So that's why it's very important to follow us on fy.mathclass.com.uk. So, and if you want to go for a review, I'm happy to post a slide on our page, on the event page, or on our Facebook page. So if you guys want it. But remember to follow us on Mathclass on Facebook. We join our group. So remember there's a specific group, F1 Survival Guide group, and also follow us on fy.mathclass.com.uk.
Awesome, thank you. We've got a few final year medical students with us, I think, who've been asking, is there anything that they can do during this time to prepare for their e-portfolio? Sam, is there anything that you have to say for that?
So I would say just get around of how to use the e-portfolio. So if you are very, very interested, so don't worry, the e-portfolio is not that difficult. It might be a bit like tricky at the beginning, but all of us have been to on that stage, and then we all survived at the end. So so don't worry too much. But if you are very, very interested, if you are very keen, so you can go to look at for some information, and then also maybe you can ask your F1 and to see what do they find it difficult to use, and try to play on it. And then yeah, that's it. I don't think there's anything to add. Anything to add, June?
Not really. For me, before we started F1, the school transitioned to using online submission of our forms, and I found that it helped, as in prepare us to do CBDs and mini cases. So if you do have time in the hospital and there is a free senior, it would be nice to practice doing a CBD case maybe, or a mini CACS examination or clinical examination, just to prepare for F1, I suppose. Yeah.
Okay, thank you guys. So can I just direct the next question to Rebecca and Leanne again? So so the next question that you got is, if there's a complaint made against you or something like that, then who's our first port of call, and what do you recommend we do in that sort of situation as an F1?
You're all right with me to take this one, Leanne, if that's okay? Yep. So if it's a complaint made by a patient or patient's family, then absolutely that's with regards to your indemnity, so you'd come to your defence organisation. If it's a complaint or a disagreement between colleagues, then that would fall more under the BMA, because that's related to your employment. So it depends on who the complaint has come from, but I suppose what you would normally see is the complaints are more about patient care, and that's always falls on your defence organisation. So you call the MDU, you call us 24 hours a day, and we would help you with that.
Thank you so much. Leanne, is there anything that you wanted to add to that?
No, that's exactly right. The BMA don't deal with patient complaints. That would be your defence union, as Rebecca says. But if you had a grievance or something that you wanted to take out through your employer, about your team member, a colleague, whoever it might be, then yes, your port of call in that case would be the BMA.
Okay, thank you so much. And just Rebecca, while we've got you here, so if in the unlikely situation that there's someone is threatening to put a case against us, or we've got some legal action against us as an F1, what do you recommend that we do in that situation?
It's a really good question. It's probably worth saying that it is very unlikely. So if you are going into your foundation programme, it'd be very, very unlikely for that to happen because of how supervised you are. But if you do find yourself in that position, the first thing that you should do is speak to your defence organisation. It's completely confidential. We'll open a case and support you through that. If it's not necessarily that a complaint has gone in, but you foresee that there is a medico-legal issue that is arising, you can also look for support from your educational supervisor or senior colleague that you feel that you trust, because you're working with people with a wealth of knowledge. So there are a number of people that you can turn to for support. But all I can reiterate to you is, when you're out on the wards, please don't feel like you have to deal with something on your own. Please contact your defence organisation as and when you need them. We would much rather you call us and it turn out not to be an issue, than you feel like you have to wait for it to become something formal, and then you've gone through a lot of stress which you didn't need to go through. So please contact us as and when things arise, even if it's something like helping you write a report if there's been an adverse incident. We'd much rather you call us for the advice earlier rather than later and feel like you have to go through it on your own.
Thank you so much. Just another question that's come to mind from my own brain, actually. Sorry, we haven't submitted that one, but I wanted to know. If we come across something on the ward that we are a bit worried about, or we're a bit concerned about the ethics of it or something, could we ring the MDU for advice on that before we approach anyone from our immediate team, if we're just sort of like not sure about this?
Yeah, absolutely. If you want a sort of a soundboard, somebody who is independent from your hospital, absolutely call one of our medico-legal advisors. They're qualified doctors, and they've had many years working in the NHS, so they understand the stresses that you're put under. You can call us anytime, it's completely free, call us as much as you like. What we would say is if it is a team decision that needs to be made, it is always best to obviously have that conversation with colleagues if you feel comfortable to do so. But certainly if you feel like there is an ethical issue or an ethical dilemma and you're not sure where to turn, then absolutely pick up the phone, and we can sort of discuss that with you. And if nothing else, it's an informal conversation you can have. It doesn't mean that we need to sort of make a formal case or anything. It just means you have an opportunity to have a sounding board with somebody who's independent. Thank you.
And is there like an out of hours number or something like that we can ring?
Yeah, so it's the same number. Our medico legal number is on our website. It's the first number you'll see. It's an 0800 number, and you can call it 24 hours a day. The medico legal advisors do say to us, if it's not urgent, they would encourage you to call them between 8 and 6. They do like to sleep as well. But joking aside, if you're worried about something, if you're on the wards late at night and there's something that's worrying you, then please do pick up the phone and they'll be able to answer that with you.
Thank you so much. Thank you. So if I could pop Sam back on, just a question about PDPs. So someone's asked if you could give some examples of what a PDP would be and what sort of things you would write in a reflection.
So thank you very much for that question. So for PDPs, right, as I said, it is basically about what you want to learn and how you're going to achieve that. So when you think about PDP, so you need to know, of course, like you need some. So remember, I talked about SMART. So basically, you need to think. First of all, you need to think about something relevant to your rotation at first. For example, if you are doing medical rotation and you want to go to theater, that it doesn't make sense at all, isn't it? So and then you need to think that whether you can achieve, and then you should also be specific on what you want to learn. And also you want to make sure things needs to be like measurable. For example, I can cite an example of what I made up, or an example of what I did for a PDP in pediatrics. So I basically I wrote PDP on I want to learn about the emergency treatment when there is a alert call. So I basically I just put it as a content, and then the way I achieve that is to follow a registrar to the A&E and to observe and to learn and to also read the guideline, the resuscitation guideline, also known as the APLS guidelines. And I use 4 months because for my rotation is my 4-month rotation to achieve that. So this is one example that for a PDP. And in terms of reflection wise, I would say think about what you observe on during your rotation, and if it's something that triggering you really like triggering you emotionally, or something that you really learn a lot from that event, it's also good to write it. But also remember that reflection is something on record, so I would say write something more positive in terms instead of something that is negative and might have an impact on you. So I can cite an example, and also it's also important that, as I mentioned, mapping. So it's also important that you look at the mapping curriculum and to think about what you observe during the ward and how can you relate with these requirements. So this is basically the advice from me. Anything to add, June?
PDPs can sound scary at first on how to write one, but if you have absolutely no idea on how to, it will be great if you can. Supervisors, they will be very helpful in terms of coming up with a few of them if you absolutely have no idea. So if you can always seek help from them, at any time. I'm sure they'd be happy to help. In terms of reflection, like Sam mentioned, you can write anything that you've observed during your work time, and positive stuff will be great. And always reflect on what happened and what you are going to do so that you can make it better, deal with it better in the future, right? That's basically it.
Thank you, guys. So June, while I've got you here, there are a couple questions about QIPs and audit. So people were asking, do you have to close the loop and re-audit in order for the QIP to count?
No, you don't have to. It would be great if you can arrange to do that, but it's not necessary for you to get it signed off. Yeah.
Mm-hmm. Okay. And with the PSG and the tabs, is that only in F1, or do you have to do that throughout over the 2 years?
Sorry, what was that?
Sorry, so the PSG and the tabs, like all that multi-source feedback stuff, do you have to do that only in F1, or do you have to do that in both years?
Both years, definitely both years. Yeah.
So 1 per year.
Yeah, that's right.
Okay.
So let me just explain this more in detail. So basically, for PSG, PSG is linked to your end of rotation report from the clinical supervisor. So that's why you are required to have 3 to 4 PSG per year, depending on how many rotations you have. For tab, is an annual thing. So so basically, ideally you should done it at the first rotation. So you're required to do 1 on F1 and 1 on F2.
Just to correct, for QRAS, when you do a tab, you need 2 tabs for a whole year. So it's a bit different from the England side. So out of 3 blocks, you have to do at least 2 tabs over out of 3. Yeah.
Okay, thank you, guys. So we're running over a little bit, so I'm just going to ask a couple questions to finish off. So one really quickly to Leanne. Someone was asking, is it compulsory to have BMA membership?
Funny old thing, I was just replying in the chat window to that message, and I will still publish it so other people can see it. But whilst it's not compulsory to join a trade union, it is very highly recommended because we have your best interests at heart when it comes to any employment issues. Certainly with the BMA as well, there's a real strength in numbers. We've over 161,000 members. So as far as medical trade unions go, we've certainly got that real strength behind us, and we would recommend that you join so that we can offer you all the individual benefits and services, obviously, but so that we can represent you adequately as well, both locally and nationally in negotiations. So if you're one of our members, it means we can represent you adequately. So yes, it's not mandated, but it is very highly recommended. And I'll just pop something else in there as well, which I've also written into the window. If you're not already a BMA member at the moment, you can join now and pay nothing until October. So why would you not? You know, we're here to check your contract for you, your rota, your very first pay slip when you get that. Yeah, be at the end of the phone with any queries, any concerns, any problems that you might have.
Thank you. And Rebecca, if I could ask you sort of a similar question, is it compulsory to have indemnity? Is it compulsory to join the MDU?
So as I tried to sort of explain in my presentation previous, it is compulsory that you have your claim to compensation being paid for, but that is paid for by the NHS if you're doing only NHS work. So it is recommended, like Leanne said, it's recommended that you have the service of a defence organisation, which would then help you in terms of your reputation rather than the reputation of your hospital. But it's not compulsory if you are working in an NHS post. It is compulsory if you take on private work or work that is sort of outside of the NHS, because then there isn't anybody picking up those claims of compensation. So that's just something to consider. But legally, you have to have your claims of compensation being covered. The rest of it is then up to you as to whether you want to indemnify yourself against complaints and GMC investigations. That's really then decided by yourself.
Thank you so much. So I'll just pitch this very, very last question really, really quickly, Sam, if you could answer this for us. Can nurses sign off your core procedures?
Yes, absolutely. So, so if you remember, I spoke about I split the core procedure into two bits. So one is the doctor's bit, and one is the one that are usually done by the nurse. And so that's why I recommend for those procedures that are usually done by the nurse, you go and follow the nurse, and then try to volunteer and help them, and they can sign off on the e-portfolio as long as they register on the portfolio. And I think most of them they are registered on the portfolio.
Awesome. Thank you so much. So I think that's all the questions that we have time for today. Thank you guys so much for joining us. I'll just pass it back on to Sam to round up and finish off there.
Okay. Thank you very much for those of you who attend and ask the questions. So of course, thank you very much for Rebecca joining us from MDU, and thank you very much for Leanne from BMA joining us again and answer some more questions about the contract. And of course, a big thank you for June. He rushed back from the theater and to help us to do the talk. Really appreciate that. So next one. For the next time, we are going to do a talk on quality improvement project and audit. So make sure you stay tuned and follow us. So remember, our website is fy.medcast.com.uk, and we have got a Facebook page on Medcast, the name, and then we've got a Facebook group. It's called F1 Survival Guide. Okay, so hope you guys well and enjoy the rest of the month, and then good luck in terms of starting in August time. So I will see you all in August.